Hi, Bedford Chiropractic Clinic, Dr. Sandy here again. Today in this short video I want to introduce you to Jessica. The lovely swan. But I want to show you that chiropractic is not just for adults, it's for everybody. And this is really important. And especially for children, because children do a lot more damage to their spine and backs than we do. The nice thing for them is at that stage is that their body is resilient. It's got stuck in a chronic state of muscle tension, so the joints are still quite flexible, the muscles are flexible, and then depending on their age, there's still a lot of cartilage, which obviously is a lot more flexible than bone is. So it's important though that they get checked, because their nervous system can still be compromised. If the nervous system is compromised, then there will be some weakness which could lead to problems later on. So let's have a look and see what we find with Jessica. So, would you mind pushing your arm up, my lovely? Pass your hand that way. Beautiful. And push up that way. Much better. Push up. Very good. And push down. Incredibly strong. Really good. Much better than your brother. Now, hold that leg there for me, my darling, and push that way, hard as you can. Push. Brilliant. And push towards me. Very good. Bend this knee and pull up towards you. Hard, hard, good. And push up again, hard, very good. Now, arms up in the air. And let's have a little look. I'm going to give you a little big stretch, big stretch. Okay, and come back to me. Good. So, yeah. So she's a little bit tense right in there. Okay, if I push down, my lovely, is that okay? It hurts on this side, doesn't it, a little bit? So she's a little bit tight on this muscle right in here, the psoas muscle, the major hip flexor, really important muscle for backs. So we're just going to loosen it up. This is called an activator. What this does is this basically puts a very fast but shallow thrust through that point, and it stretches the muscle really, really quickly. It's quite painless, unless it's in a very tight muscle. And we also have the facility here where I can sort of adjust the strength of it. And obviously for children, we're going to be using it at a very low setting. So we're just going to adjust there and there. And Jessica is obviously a bit ticklish, so that's a good thing. Wonderful. And push up again towards you now. We're just going to activate the muscle. Pull up towards you that way. Good girl. And push up again this way. Push. Good. So, how does that feel? A bit easier? Yeah? Good. Up you come for me. And just sit there for me, facing that way. Brilliant. Just going to have a quick look at your neck now. That's moving quite well. Look this way for me. Good. Look the other way. She's a little bit stiff going to the right. And, ooh, you okay? Yeah, it's a bit sore, isn't it? She's a little bit sore on her C1 here, so we're just going to adjust the C1. That's it. And if you just look this way again, my darling, just look this way, and there's a little bit more play there, so she's a little bit looser. Good. Up you come, and just lie in your tummy for me now, okay? That's great. So again, I'm just going to bring you back a little bit, Jessica. So bring the towel with you. Bring the towel with you. Well done. Okay, so let's see. Arm just by your side, my lovely. That's it, just down there. Perfect. And if we have a look. Okay. Okay, a bit of a difference there. And if we bend the knees, and a bit of a difference there. Okay, so again, with Jessica, what we've got is we've got a bit of tightness right here in her SI joint. Okay, because that, sitting, falls, jumping up and down, is all going to be a problem. So if we just loosen this up, so I'm just going to loosen that by just releasing a couple of ligaments here, and also right there. That's good. And if we look down, you can see immediately there's been a relaxation in her leg. Yeah? And this is going to be easier for her now. Now, let's have a look at the rest of you. So, if you wouldn't mind just putting your arms down here, my lovely, and this arm behind you. Perfect. And this arm behind you. Perfect. Now, this is a very objective way of checking the spine. Yeah, I could do it the traditional way of palpating and the fingers are now, after 18 years, are that sensitive that will pick up the majority of what we call subluxations. But this is a really objective way of looking at the spine and seeing where those subluxations are. You bend your knees, that's it. Good. And arm down, and this arm above your head. Very good. And both arms above your head. And arms back. Head to the right. That's good. And now this way. And she turned left, but that's okay, doesn't matter. Okay, so can we see that? When she turns her head to the right, her legs go out slightly. Now that is an indicator that we've got a bit of pressure right there. So we've got some stiffness and tightness right there. So we're just going to release that. And it really is that gentle. Turn your head to the right again, Jess. This way, my darling. This way. Wonderful. And if we check now, you can see that it's much better. All right. But more importantly, does that hurt now?
No.
No. Are you sure?
Yes.
Good. Turn your head to the left now. Very good. And that's it. Good. And we're done. And that's it. It really is as simple as that. I'll become. So just look up there for me. Okay. So chiropractic is not just for adults, it's for everybody. Yes? Absolutely. Thank you.